So it's recording. You see the hello,
Hello.
Miss Wendy. How are you?
Very better, but I'm okay.
My name is Lucy Ankrah. I'm a nurse practitioner and I'm a doctorate student from University of Massachusetts.
Okay.
And I just have to tell you that today everything we discuss is confidential. Okay, nobody will know. I'm not going to tell anybody. It's just at this place. Okay, and the only time that I have to call somebody is if you tell me that you're going to kill yourself or you have any intention of killing somebody. Okay,
Alright.
all right. So for that, I have to, refer you to a psychiatrist, so I have to take you to the emergency room. Uh, that's the only way that somebody will know. But everything we're doing here is HIPAA and it's confidential. So I read a little bit about your chart, and thank you so much for filling the form. I just want to know a little bit what brought you here.
Um, I don't really even know if this is what I need or I'm just being a mom and stressing out. But my husband thought it would be better to come speak with a professional to kind of get better insight on why I've been feeling so anxious lately. And not lately, maybe over the last couple of months.
So, why do you think you get anxious?
Um, I, I mean, I know why I get anxious. Like, well, our daughter, she's our only child, and it took us a long time to get pregnant. But when she came, we found out that she had sickle cell disease. So she's been sick most of her life. So I didn't work. I was a stay-at-home mom. I took care of her her whole life, and then she went away to college. And ever since she's been gone, I just always feel like I'm gonna get the call that something happened to her. She's young. She's over there. She wants to be normal, but she has to know her limitations. I worry about her constantly.
Mm.
And when she went to school, it wasn't like maybe 4 weeks or so. And then she had a crisis while she was up there. So she's in Boston, which is 4 hours away from us.
Mm.
So we drove down to be with her. But then even leaving her was scary because you don't know when you're gonna get a call that she's in the hospital again. So I kind of
How long? So I don't mean to interject, but how
okay.
long has she been away?
Well, the semester started. We dropped her off in August. She started school beginning of September. So she's been away. How many months is that? I can't do the math.
Mm-hmm.
For a couple of months.
Mm-hmm.
I mean, she came home for Christmas and Thanksgiving and all of that, but she's been away. It's her first year. She's a freshman. So she's been away since August. We dropped her off August for orientation, freshman orientation.
That must be hard for you.
That is hard for me, and and a part of me doesn't understand why it's not hard for my husband. Or I mean, I guess it's a man thing, where he's like, "Oh, she'll be okay." But I'm the one that's been with her her whole life, Like I'm the one that stayed home with her, that took care of her, you know.
So when she was home before
Mhm.
she went to college, was she having crisis or anything?
She used to when she was a lot younger, and then we started seeing. We took her to the Children's Hospital in Philadelphia. We had a really good doctor who specialized in it, and we were able to control her disease, so she didn't really have that many. And I stayed on top of it so that she didn't have any crisis. So I managed her care, made sure she was always good, hydrated, didn't do too much. So for a while, most of her, like most of elementary school, most of middle school, not so much. Even high school, not so much. Um, but I mean, there's those times when she was preparing for the SATs, when she was preparing for college, she had a little bit more because of the stress. But no, she's been doing well because I kind of stayed on top of her. But now that I'm not there to kind of watch over her and watch over what she does, her activity level, whether she's dressing properly, I think that's the part that makes me feel extremely uncomfortable.
And do you guys stay in touch? Like every day, do you talk to her?
We do. We know these kids. Like I call her, she doesn't pick up. I text her, she'll text me back. But it's not like having her in the house and watching her and watching everything that she does. So I try to text her, and I try. My husband tells me not to call her all the time, to leave her alone, kind of let her live her life, and that she'll be okay. But as a mom, I don't know if you have children,
Yes,
but
I know how it feels.
yeah, you
Mm-hmm.
always worry about them. You always
Mm-hmm.
want to make sure they're okay. So I try my best not to be overbearing, but you can't help it.
And how old is she now?
Right now, she's her 19th birthday is, and she was born in October, so she just turned 18.
Okay. So that makes you worry a lot,
Yeah,
correct?
yeah.
And so before that, I just want to ask you a little bit of questions about your medical history, and
My
then I'll
medical
see your
history.
medical
Okay.
history because right now we want to try and then fix, if there's too much problem, if we have to give you medication. So I just want to know what actually is going on right now. Okay.
Okay.
So first, do you have any allergies? Are you allergic to any medication?
Not that I know of. When I was younger, my mom told me I had a weird thing with when I was given is it, how do you say?
Penicillin.
Yeah,
Mhm.
but I think that went away. My doctor told me that like sometimes you have it when you're younger, but then it goes away. So I haven't really had. But otherwise, no food allergies or anything like
Okay. And do you have any medical history?
that. I miscarried twice. I don't know if that's a medical history.
Mm-hmm. Mm-hmm.
Um, but no, there's diabetes in the family and hypertension in the I probably have hypertension now, but it hasn't been diagnosed.
Okay. And have you done any surgeries?
Well, my daughter was a C-section.
Okay. That's the only surgery you've had?
Hmm.
Okay. And I'm going to ask you about your social history. You smoke?
No. Well, I tried marijuana when I was younger, but no, I don't smoke.
And then you do any drugs
No,
like cocaine?
no.
Okay. Heroin?
No.
Okay. Any alcohol?
I enjoy a glass of wine.
Okay. And how many times do you drink?
Oh my God, since this girl left, it's like maybe more than before. So
Okay.
maybe like every day, sometimes for lunch, sometimes for dinner, more frequent than before.
So one day you do like one glass of wine a day, or you do it for breakfast, lunch, dinner?
But during the week, maybe just for dinner
Mm-hmm.
every day, but on the
Mm-hmm.
weekends, maybe two or three.
Mm-hmm. All right. So I'm gonna ask you about any psychiatry history.
Okay.
So do you have any, before that, have you ever inhaled like a glue or in your life, or people inhale alcohol, any substance they get? Have you ever done that before? Air
No,
freshener?
no,
Okay. Have you done any ecstasy, benzo?
no.
All right. And then let me go back a little bit about your drinking.
Okay.
Okay. When what you say you like drinking wine, right?
Hmm.
Have you ever tried to cut down? Have you ever thought, this is too much, I want to cut down to it?
Well, it's not like I drink to get drunk. I
Mm-hmm.
just drink to get like just to help me relax, to help me sleep a little bit, especially more so in the last couple of months. But it's not like I'm taking a shot of vodka every night.
Mm-hmm.
But before, maybe it would be once in a while that I would have a glass of wine. But since she left, it's hard for me to go to sleep. So I find that I drink at least a glass every night, and then on the weekends, especially if I don't hear from her at all, maybe two or three glasses in the day. But I mean, wine is good for you anyway. Isn't that what they say?
Yeah, that's what they say, but too much of it is not good too.
Okay.
Now, the question is when you drink like that, does your
Mhm.
husband comment on it?
I mean, I think at this point, anything to keep me shut up and and not stressing out, he's like, whatever. But I mean, I think he's made comments kind of like, oh, you might want to relax a little bit, but um, I mean, I'm not an alcoholic if that's what you're thinking.
And no, I'm just checking. Do you really get annoyed when your husband mention you drinking?
I mean, he makes comments here and there, but once again, like it's not excessive, you know. So
Mm. Okay. Do you feel guilty?
when I drink,
And then let's say you drink, and then the drink wears off,
mhm.
and then like it makes you sleep. You wake up, you're like, oh, why did I do this?
No, because it's not like when I was young and in college where you
Mm-hmm.
drink to the point that you don't like you black out and you don't remember what you did. Or, no,
Mm-hmm.
it's just enough to help me sleep and enough to, and I don't think I feel remorse or anything. It's relaxing. I enjoy
Okay.
it.
And then when you wake up in the morning, you think like, if you don't get a drink, you feel like I need a drink to survive.
No, no. When I wake up in the morning, I mean, of course, the first thing I check is my phone to make sure I didn't miss a call from her or from the hospital or anything. But no, I don't really feel like that. I mean, if I drank 3 glasses and I didn't really eat much, maybe I'll feel like a little funny in the morning. But otherwise, no.
Okay. Have you ever drunk and be driving before?
No, 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 no.
Okay.
Usually my husband drives.
Okay. So do you want to quit the drinking? You feel like you want to quit?
No, I think I enjoy the drinking.
Okay. Okay. Have you ever been anxious or have any panic, that you or hallucination when the drink is not there?
No, 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 no. It's not that
Okay.
serious. No, no, no,
Okay.
no, no.
Okay. Good to know. So how is your mood? Do you sometimes get angry and excited? 1 minute you are like, angry about something, another minute you get excited.
that's that's been me my whole life, but I mean, not anything out of the ordinary. I'm naturally a moody person, but nothing out of the ordinary. I think the emotion that I feel the most nowadays is just maybe it's, I don't know if fear is the right word, but it's just
Hmm.
immense concern for my daughter.
Hmm.
But not anything out of the. I mean, maybe if you catch me at the beginning of my period, I might not be the happiest person, but otherwise, I don't think so. No.
And how is your sleep?
Um, Before she left for school, I think I slept okay. But ever
Hmm.
since she's been away, if I speak with her and I know she's okay and I know she's home, like I can sleep okay. But let's say if she's out and she calls me and tells me she's going out with her friends, and then I worry and I can't sleep until she gets home. So though I guess it's on and off.
So when the days that she calls you and then she tells you she's going out with her friends,
Mhm.
do you sleep and then wake up abruptly, like thinking about her, or you don't sleep at all? The
I don't
sleep doesn't come
I
in.
don't sleep at all. I literally check my phone every 2 seconds to see if I can get a call from anybody. I don't sleep at all until she's back in her dorm and safe. No, I don't sleep
Okay.
at all.
So do you get up in the morning since she's away? Do you get up in the morning and you're thinking, I don't really want to do anything. I just want to lay in bed. I don't want to get up.
Uh, not so much. Not so much that like that. I don't want to. No, I think I. I don't know if you understand this. It's just you live a better part of your life for this person that you created. You know. So I mean, I was a stay-at-home wife. Now I'm like trying to find little things to do to keep myself occupied since she went away to
Now that
school.
she's not here.
Yeah,
Hmm.
you know. But
Hmm.
I mean, my husband works, so I'm usually home, you know, and then I get up, I prepare food, and even now I don't really cook that much because it's only my husband and I. But as far as having the desire to get out of bed, I do. You know, I don't feel like depressed in bed. No.
And when
Um,
you get up, how is your energy level?
um, I'm getting old. I guess my energy level.
You say for you're only 42 years old.
I know, but it feels. I guess my energy level is it's it's okay. I mean, I'm trying to work out. I mean, my doctor told me that I need to lose a little weight. So I've been trying to like take walks around and stuff. But once again, it's like you're here by yourself. It's not really nobody to really speak with or like do stuff with during the week. 'Cause my
Mm.
husband is up, goes to work. So
Do
I
you
think
normally like read or watch TV or do what is your activity like when you're in the house
um
alone?
I usually wake up. I love the Wendy Williams show.
Mm-hmm.
So I wake up, I'll start preparing dinner for my husband, and I'll watch the show, drink a cup of coffee, and maybe I'll call my family, check on my parents, and then just maybe watch reruns of Housewives or whatever. And then sometimes maybe like I'll try to get in touch with my daughter. And if I am able to speak with her, I usually talk to her before her afternoon classes. And then if not, I just cook. Maybe I'll go to the mall, meet some of the girlfriends for lunch.
And do you
And
have any problem with concentration on one thing? Does your mind wander?
my mind wanders around my daughter.
Mm-hmm.
Like any moment that I have to myself, I think of her often, make sure, like, pray that she's okay and worry about her and how she's
Mm-hmm.
doing. I mean, if my when my mind wanders, and the bad thing is lately, especially since her last crisis, I've been having this like, where I'm like, oh my God, something bad is gonna happen, something bad is gonna happen. So my mind wanders into that direction, you know.
Have you ever been alone and then you burst out crying for no reason?
No, the times that I've done that has been the times that she was sick. You know, when
Mm-hmm.
we got the call that we had to go back to the school
Mm-hmm.
and check on her. It's like you feel like you can't even like breathe, you know. But otherwise, no. And we stayed there, of course, with her until she was able to go back. My husband came, but I stayed with her. And then when she was good and well to go back to the school, then I returned home.
Any suicidal thoughts? Have you ever thought about, you wish you slept, you didn't wake up?
Oh God, no, no, no,
Okay.
no.
Have you ever had a thought of, harming somebody?
I mean, other than my husband every now and then,
That's a joke, right?
That's a joke.
Okay, okay, just to make sure. All right. So, is there sometimes that you feel like, oh, you're so elated, you're so happy? Uh, I wish I'm running for presidency right now, or something you feel like, oh, I just won the lotto. Do you get that feeling of high feeling, something good is happening or going to happen?
I mean, I feel like that when I go and shop right is having their can sell.
Okay, okay. Just checking on that. Okay, and then once a while, do you feel like you are down?
I mean, once again, the only time that I really
It's
feel
all
like,
about your
yeah,
daughter?
when she was
Okay, okay. So let me ask you a little bit of, do you have any, I know you have a lot of anxiety. Do you normally get headache?
I get headaches. I kind of always had headaches ever since I was young.
Mm-hmm,
I mean, of course, especially when I'm not sleeping and I guess when I'm stressed, it
mm-hmm,
usually starts back here.
mm-hmm,
But the doctor told me that it could be related to my glasses. Is that
mm-hmm.
true?
Yeah,
Because
it's possible.
um,
Do you wear glasses?
I wear glasses. I have my contacts in right
Mm-hmm. So when you don't wear it, then you feel headache?
now. Yeah, like when I oh if I wear it for too long, sometimes too I feel the headache. It's weird.
Okay. But when you wear the contact, do you feel headache when the contacts are on?
Not so much with the contacts, no.
Okay.
I went to see the eye doctor. What do you call them again? Yeah,
Ophthalmologist.
all these damn names.
Mm-hmm.
But I went to see them
Mm-hmm.
because of the headache. So the doctor thought it could be related to my vision, and they
Mm-hmm.
changed my prescription. So since then, I guess
It
it's been
works
better.
well. Okay. Do you normally get any nasal discharge and then pain here, sinus pain?
No, no, I
Okay.
don't.
Any dryness in your mouth?
No, not really.
Okay. You normally get palpitation?
Once again, when I don't hear from this girl, my
Mm-hmm.
heart is like racing. Or even when she
Okay.
calls me sometimes, my heart is like racing because I don't
Okay.
know what she's going to tell
You
me.
you think something
Yeah,
is going on?
yeah.
Okay. Any abdominal pain,
No,
heartburns?
no, not really. We eat
Okay.
a lot of spicy foods,
Mm-hmm.
and I think age is catching up to me.
Mm-hmm.
Before I could tolerate it a lot better, but now when I eat and feel like a little like, especially if I eat late when
Mm-hmm.
I try to go to sleep. But
Okay.
otherwise, no.
And how is your appetite? I forgot to ask you earlier.
Um,
With your daughter not there, do you feel like when you sit by the food, you cannot, you don't have any taste of it? Do you just eat because you're eating? How? Tell me about your eating habit.
well, I guess that's true because now that you're home by yourself, I usually eat my biggest meal with my husband when he comes
Mm-hmm.
home.
Mm-hmm.
We'll have dinner together, but during the day, nah, like I might snack on this and that, but not really. But then again, I think ever since having her, I've had that, like, because
Mm-hmm.
I'm always so busy chasing after her and making sure that she's okay, that I don't know. But I mean, I haven't lost weight or gained any significant weight, so I think it's been the same.
So, about your anxiety, do you find it hard to control your anxiety?
Um, lately, yeah, because I'm just worried about her. Maybe I should just let her come and stay home and go to school nearby. I don't know. But lately, I guess in that regards, yeah, it's hard
Mm-hmm.
because it all depends on her and how she's doing and how everything is going.
Have you
So,
ever like you sleeping and then you wake up
of
feeling
course,
like you having some attack,
of course,
panic
and then
attack,
I
thinking
have
about
like,
her?
cause you know what it is. We had a my husband's friend, like they had a son who also had the sickle cell disease,
Mm-hmm.
and he passed away very very young. You
Oh,
know. It
oh,
was like one summer he was
mm,
just out playing, and I
mm,
guess he overexerted himself. Went to sleep, never woke up.
mm.
So it's
How old
like
was he?
he was young, maybe 16,
Mm,
15, 16.
mm.
You know,
So that would be like not far from.
yeah. And
Oh,
then even that he was home. The parents were there. You know, my daughter has a room. We got her a single room just because of just so she could have her space and her privacy and that with the illness and all.
mm-hmm,
So sometimes I sit and think like if something happens to her and nobody's around, like
mm-hmm,
who would know? And that's in itself is scary, And I know she goes out with her friends. I don't know what she's doing half the time. So I can't know if oh my God, she's like usually I could tell when she's doing too much and I could tell you have to relax so you don't have a crisis. But
mm-hmm.
in this situation, like, you almost feel so helpless, because you don't know what's going on. Like sometimes I'm like, oh man, I want to put a camera in her room or something, just like a spy on her. Because it's like she could just go to sleep and not wake up, and you don't want to get that call.
So do you feel like this is the only situation which has brought your anxiety or something happened before which you got anxious and then it went away and then now the her situation of being away from home gave you that kind of anxiety?
I think it's been like an up and down thing. Like when she was younger, and of course, we found out she had this disease, and we didn't know much about it. We didn't even know we were carriers. We were silly. We didn't check.
Mm-hmm.
But we found out she has this disease, and when she was young, when she would go to school, I would worry until I'm like, okay, she's okay. When she would go on school trips, I would worry. When anything, you worry, but it was in like sporadic thing, like it wasn't consistent.
Mm-hmm.
And on all those situations, she always came home, or
Mm-hmm.
I was close by, you
Mm-hmm.
know. But now it's like,
So this has been going on for like 8 months and it comes seems to get better, correct?
yeah, because she's away from me.
Mm-hmm.
Like I don't know. Like, how do you not worry about your child when they're not close to you and
Mm-hmm.
they have this illness and she's never had to manage it by herself,
Mm-hmm.
you know? So that's what I worry about. And she wants to be like a normal teenager. She doesn't want me on top of her. I told her to stay here, go to school nearby, commute from home, but she said no. So, I mean,
Mm-hmm.
I don't know what else to do.
So now let me go back and see, why you are so anxious. But do you have any family history of any depression, anxiety, post-traumatic stress disorder in the family? Any psych disorder in the family?
We don't go to a psychiatrist to even be diagnosed. I
Mm-hmm.
mean, we call people, be like, oh, this one is bipolar, this one is this one is that.
Mm-hmm.
But for it to be like clinically diagnosed, no.
No.
No, not that I know of,
Mm.
actually.
So have you ever taken any medication to be able to sleep better? any
No,
over the counter or anything to be able to sleep better?
no, but my husband was telling me that a friend of his recommended what is it, melatonin?
Mm-hmm.
What was that?
Melatonin.
Yeah, that.
Yeah.
Um, but I don't like
Have you
taking
tried
stuff.
it?
No, I don't like taking stuff. I usually try to drink like I mean, other than my glass of wine.
Mm-hmm.
Um, maybe I'll try tea or something if I
Mm-hmm.
really can't sleep, like the sleepy time one.
Mm-hmm.
My husband will make that for me, but no,
Do you think that anxiety has caused some medical problems for you?
oh my God, I hope not. Not that I mean, other than the last time I went to see my
Mm-hmm.
primary doctor, he told me that my pressure was a
Mm-hmm.
little elevated,
Mm-hmm.
but he's been aware of the situation and what's
Mm-hmm.
going on, so he kind of just told me that the next time, I think he told me to come back either in a, I want to say a month
Mm-hmm.
or so. So he didn't put me on medicine because he said I don't need it because I've always had good blood pressure. But he said maybe come back and they'll check it again and see. And if it's consistently high, maybe
Mm-hmm.
they'll put me on medicine. But
Mm-hmm.
I really don't want that. That's why my husband recommended that. I mean, at this point, maybe I should talk to somebody and see if it'll help me.
We have something we call, anxiety. From hearing from you, I think you have a separation anxiety disorder
Mm-hmm.
related to your daughter going out to school. And sometimes this happens, like people get grief, and then it's a short term. Even though it's a short term, sometimes if you think it's affecting you, and it's very difficult for you to notice to the extent what is going on.
Mm-hmm.
But since your husband has noticed it, if you want, we can give you just medication. You take it at night, it helps you sleep better. And then the next day you are okay, because if you don't sleep, that can also affect your health. Sleep is really good.
Oh, I don't really like. Actually, I'm sorry. I don't mean to be rude. I
Mm-hmm.
just want to check to see.
Mm-hmm.
Okay. I don't really like to take any
Okay.
medicine. Is there something
Okay.
that I could do, like otherwise?
You can also go through, like, people go through yoga relaxation techniques,
Mm,
and then I think you have to talk to your daughter,
mm,
always advising her this is, how you can prevent yourself from getting crisis,
mm,
because doing too much can also affect her. So let
mm.
her know that. I believe you've been talking to her about it.
Yeah, yeah, I
And what does
definitely.
she tell you?
And then of course she's yeah, she was it's like, oh my, I know, and she's like, I
Mm-hmm.
know.
Mm-hmm.
And she's not really the other time I saw on her Facebook, I went on my husband's Facebook. I don't have one of those things, but she was out with her friends. It was cold that
Mm-hmm.
weekend, and she had
Mm-hmm.
like a little shirt on. And
Mm-hmm.
what am I gonna tell her? I'm stalking you on Facebook, you
Mm-hmm.
know?
That would be nice
Yeah.
too.
So it's just like
Mm.
trying my best to be like, all right, like, and she
Did
just,
your husband know that you went on her Facebook?
yeah, he did. Well, cause
Mm.
I don't have one. I don't really have
Mm.
any interest in
Mm.
any of that.
Mm.
But I have his password and stuff, so I check it occasionally on my on my phone.
Mhm.
Because I don't like he could be she thinks he's so cool, so she doesn't mind if they're friends on Facebook. But so I kind of monitor her through there. But see stuff like that. What are you gonna tell her? Like don't have fun, don't enjoy your
Mhm.
youth. Like I wanted to tell her go put a damn turtleneck on. Like what is
Mhm.
wrong with you?
Mhm.
But
You couldn't.
you know,
Okay,
so
so right now what we're going to do is we have some exercise therapies that they can help you with yoga. They can also help you with breathing exercise to help with your anxiety, since you don't want to take any medication. And
mm-hmm.
then when you feel like it's getting too much and you want medication, normally we recommend, you take anti-anxiety medication, like not continuous. You can take it at night for you to be able to sleep.
But can I
If
drink when I take that?
no,
Oh no,
and
then I don't want it.
drinking too much too will affect your liver. So we don't
Mm,
recommend. The most drinking that we recommend is 1 glass of wine a day. So
mm.
if you do more than 1 glass, it can also affect your liver. So if the anxiety is making you drink, then I would suggest that you don't you get something which you take your mind off. So since you don't want medicine right now, I'm not going to stress on that too much, but I'm going to recommend you to the nurse door we have this exercise program that is like stress relief. They help you. And I think, let me see, you have insurance. Yeah, you have a good insurance. So, you don't have to pay much out of pocket. It depends. Probably you pay a little bit of copay and then go
Each
through that.
time?
Uh, I'm not sure. Just find out from them. I
Okay.
think the beginning, you don't have to pay anything, and then the subsequent visits, you may have to pay depending on your insurance, probably $10 or, but they will determine that.
So I
Okay.
don't need to keep seeing the therapist. I could just do that.
You can go there, and then I will recommend that you come back in a
Okay.
month, and
Okay.
then let's talk again. Let me see where you are. Okay.
Okay.
And this is really good, and I'm hoping that your daughter will be good. Sometimes it's not easy thinking about her and all that. So let me know,
Okay.
and I'll give you my number. You can
Okay.
call me anytime. Okay. And then let's discuss what is going on, and the the staff will give you the phone number, and then if you feel like you want to just email the office too, you can do that. And since you are home all the time, if anything is going on, you can just pick up the phone. You want to talk about what is going on, or you want to take medication this time. I just want to know how the exercise program is also going for you. Okay? Any questions?
No, no, it's very nice
Yeah,
speaking with
it's
you.
so much pleasure to be with you today. And thank you so much. Okay? And I'll show you the door.
Okay.